So today we are really excited to welcome back Dr. Noya Duque and is going to talk to us today about COVID and GI issues, so gastrointestinal issues.
Spoiler alert, it's not just about respiratory symptoms, it's also about GI symptoms. I will attach this really beautiful chart that helps delineate different symptomatologies. So COVID, it's the short form for coronavirus, and it's a virus that manifests as respiratory, constitutional, and gastrointestinal symptoms. What does respiratory mean? Most people only associate respiratory symptoms as being the lung, but actually the respiratory system starts from your nose, your mouth, your throat, all the way down to your lungs. So you'll see some symptoms here that broach all of those organ systems. Constitutional, that's just your general body, so like your head, your shoulders, knees, and toes. And GI symptoms, that's like your abdomen or really through your esophagus all the way down to where you poop. And so I will first start with the cold symptoms. So that's highlighted in blue. And as you can see, those are typically like the respiratory tracts that I was talking about. So ears, nose, and throat. And so sore throat, runny, stuffy nose, sneezing, and cough typically make cold symptoms. But as we move to like the flu versus the coronavirus, we get more organ systems involved. And what really stands out with the coronavirus is, yes, there are instances where people lose sense, taste of smell, but also this nausea, vomiting, and diarrhea, aside from the respiratory symptoms of shortness of breath, cough, sneezing, runny nose, sore throat. Most people do associate coronavirus with the respiratory symptoms, but GI symptoms can occur as well. And again, to repeat, that nausea, vomiting, some diarrhea. And this is a symptom, like as I said, most people don't associate with COVID, but can be associated with COVID. And flu viruses, notice how I say flu viruses or flu-like viruses, can also cause GI symptoms as well. So it can be difficult to distinguish between the two. And as a spoiler alert, there is another virus aside from coronavirus that can cause GI symptoms. This is called rhinoenterovirus. And there's just some overlap between flu viruses, other viruses, and even coronavirus specifically. And so what do we typically do? Well, again, most flu symptoms are typically in the mild category. And how we treat that is hydration, Tylenol for fever, ibuprofen for pain. If you have some congestion, you can do steam showers or a vapor rub. But in the instances where the virus can progress and some people may require oxygen, there are antiviral medications, and these are Paxlovid, remdesivir, molnupiravir. These are antivirals. Again, I'm stressing antivirals because antivirals are not antibiotics. Antibiotics are for bacterial infections, but sometimes the coronavirus can have a concomitant or superimposed or associated bacterial infection that may need antibiotics. But hopefully you're in the 80% category where we just treat with fluids, eating well, Tylenol, ibuprofen, or steam showers. And especially if a patient has the GI symptoms, so the nausea, vomiting, the diarrhea, the hydration aspect is especially important because we need to keep up your fluid status in your body, because low fluid status can lead to other complications and predispose you to going to the hospital sooner rather than later. And those are things that we don't want. And so it's very important, if you are having the nausea, vomiting, the diarrhea symptoms, to just make sure you're well hydrated. And for those who don't want to tolerate so much food or they can't keep things down, sometimes the type of food might also be contributing to symptoms. So there's something called the BRAT diet. BRAT stands for B for bread, R for rice, A is and T for toast. And those are typically foods that are easier to keep down. So that's why some people adhere to the BRAT diet when they have vomiting, diarrhea symptoms. And as I said, these vomiting, diarrhea symptoms may present with coronavirus as well. So how do we present coronavirus? Unfortunately, we've had a lot of passing and death related to this epidemic, this pandemic, but vaccines are still available. Hand washing, please keep hand washing. And masking is also still very important. And so how is COVID spread? Same with a lot of other respiratory viruses, but there are some differences. When you talk, cough, or sneeze, you have these respiratory droplets. So these are the yellow particles going, unfortunately, to somebody else. And these can land in the eyes, nose, or mouth. This is also called the T-zone, eyes, nose, and mouth. And unfortunately, if those get in, they can incubate or stay for a certain period of time and then replicate, grow. However, if you are masked, notice how you're protecting part of your T-zone. And then if you don't wear glasses or if you don't have protective shielding, that's fine too. Because if you wash your hands, then that minimizes contact and spreading to the T-zone. And the particles, they sometimes land on surfaces, and depending on the amount of time they spend on that surface and what type of surface, so plastics, wood, if they aren't cleaned with alcohol-based products, they can stay on those surfaces. And if other people touch those surfaces and touch anywhere in their T-zone, eyes, nose, mouth, they can also infect themselves. And so how are we testing? How are we looking out? If I have GI symptoms, does this automatically mean I have COVID? Not necessarily. Try and think about the other symptoms that you may have. Is it only nausea, vomiting, and maybe you ate something wrong that, didn't really agree with you? That's not necessarily COVID. That might be food poisoning. However, if you notice that, okay, I might have some of these other respiratory or constitutional symptoms like fever, headache, congestion, runny nose, cough, that might point you into a virus contributing, but it still might not be coronavirus, because if you remember, as I said earlier, there are other types of viruses, including flu-like viruses or flu virus itself, that can also cause these similar symptoms. So it's important to get tested. Folks have COVID tests at home. Folks have flu tests at home. You can swab yourself with flu, swab yourself with COVID, go to your pharmacy, also get tested. That may elucidate whether or not you have COVID. And the thing is, even if the flu test is negative and the COVID test is negative, if you still have some of those other symptoms that I was mentioning before, you might just have another type of virus, and treatment is still the same. Make sure you're well hydrated. Make sure that you're eating as much as you can. Make sure that you're using Tylenol for fever, ibuprofen for body ache. And if symptoms progress, then you would need to seek additional medical care. And so, interestingly, wastewater was being tracked in different cities, including NYC, to see if COVID particles were present. And so if you do have COVID in your body will shed the virus into your stool. Also, if you've touched your T-zone and you're washing your hands, that wastewater will also go into sewage that epidemiologists or health experts are also tracking. By analyzing the trends and analyzing the viral particles in the wastewater, researchers can monitor changes in infection rates and potentially predict outbreaks. CDC experts monitor changes in the strains and then create a vaccine best for the season. Most common virus strains that contribute to COVID are the ones that the vaccines are made from. People may be hearing about the flirt mutants that are going on right now. I believe those are perfect with KP or JN. A lot of vaccines that we have now still cover some of those strains, and some people may need to get boosters, but still it's the same type of test, long and short of it, the oropharyngeal or the nasal swab, and then still keep up with your vaccines. The tests are still the same whether or not you have the GI symptoms. And so, as I was alluding to before, we have multiple vaccines coming out, and some people might get confused that, hey, I've had 1 shot, 2 shots, sometimes up to 3 shots. Why are we still getting more vaccines? So this is my plug for why vaccines are important and why we have new vaccines coming up and about. As I mentioned earlier, we do have mutant strains of the COVID virus, because as human beings get smarter and smarter, also the viruses themselves also get smarter and smarter and mutate to try and avoid the defenses that we have already made. And so this is why we create new vaccines to pinpoint some of those new mutations. And so the more people who get vaccinated, the less the COVID will spread to others, because of the concept of herd immunity. Once you get vaccinated, your body adapts and generates its own response against the virus. And the more of us who are vaccinated, the more of us who can protect not just ourselves, but also those who are, quote unquote, more vulnerable and susceptible to coronavirus. Those who are at most risk and more vulnerable are those below the ages of 5 greater than 65 years old, pregnant people, and those with chronic lung and or heart conditions. The COVID vaccine doesn't guarantee 100% prevention. However, if you do get the vaccine and you get COVID, there is a much reduced risk of severe disease and hospitalization. Vaccines are still available at your physician's office or at the local pharmacy. Babies can also receive the COVID vaccine too. The earliest age is 6 months, and the number of vaccines depend on the vaccine type, the age of the recipient, and health status, commenting whether or not you are immunocompromised. Compromised meaning if you unfortunately have cancer or some autoimmune condition, or if you have a chronic lung heart condition as well. Most people need at least 2 of the primary shots and need at least 1 booster. If you are immunocompromised, you would need at least 2 boosters. And then most people from start to finish complete the vaccine series in about 6 to 8 months. Please ask your physician about COVID symptoms, testing, and the vaccine. Just to recap, again, COVID-19 is not just about the respiratory symptoms being cough, sneezing, sore throat, runny nose. They can also involve the GI symptoms such as nausea, vomiting, diarrhea, and of course, people recognize fever and headache as part of the symptoms as well. And so even if you do have the GI symptoms, you can still be tested the same way as if you only had respiratory symptoms, which is the nasopharyngeal or oropharyngeal swab. And treatment is still the same generally if you have mild symptoms for any other virus. Hydration, the BRAT diet if you can't keep more rich foods down, which is bread, rice, and toast, and then Tylenol for fever, plus or minus some pain, ibuprofen for pain if you have it, and then God forbid if you do progress with your symptomatology and need hospitalization, there are antivirals as well. However, if you are only having GI symptoms, try and think about other causes for your GI symptoms, your nausea, vomiting, that might not necessarily be related to viral infection, might be related to food. But if you are having respiratory symptoms as well as GI symptoms, have COVID in your middle brain, forebrain, but there are other viruses as well that may cause GI as well as respiratory symptoms. This brings me to my wonderful clinic at Settlement Health. We're located between 106th Street in between 2nd and 3rd Avenue. This is our phone number. This is my card. We're always taking patients, happy to be part of this wonderful community, and these are my wonderful references. Weight loss is always very concerning, especially the rate of weight loss. When I say rate, if you're losing more than 5 to 10 pounds unintentionally in a month, that is a red flag and something to be concerned about. Specifically with the GI symptoms, if they are just diarrhea and if they are just vomiting, blood in your stool is always very concerning. You should be seeing a gastroenterologist. That's a GI specialist. Unfortunately, COVID can progress to long COVID, and we're all still trying to figure out what long COVID means because different people present with long COVID in different ways. Another thing is that, as I said, following up with a GI doctor is very important, but if you are having like blood in stool, that could be concerning for an inflammatory bowel disease. Again, this is something that a GI doctor should address with you. And unfortunately, irritable bowel syndrome is another type of like inflammatory process that may have been unmasked because of COVID or you having COVID. And inflammatory bowel syndrome, unfortunately, there aren't too many amazing cures. It's really just symptomatic treatment, which may be related to like agents that help thicken your stool and changing your diet. But unfortunately, there's no immediate like one-stop shop. But please speak with your primary care provider to see if a referral to gastroenterology is indicated. And please speak more to your provider about your symptomatology and see if there are certain medications and or diets that can help address some of the symptoms.
When they say to hydrate when you have things like diarrhea and vomiting, what is the best hydration? I know that we hear a lot about things like with electrolytes and stuff like that. How important is that, or is it you just need to drink water?
It depends on the person and it depends on what is coming out. And that's a very vague way to phrase it. So If you are having a lot of food particle emesis, or if your stools are just super, super loose, I would recommend both the electrolyte in fluids such as Gatorade, Pedialyte, aside from water, because your blood isn't just composed of water. It's also composed of some of those ions and other important electrolytes that your body needs to achieve balance. So some of my patients just prefer drinking water, fine, because they are also taking in a bit of soup here and there. They're also taking in some of the brat diet that I was mentioning. And when those components are broken down, they can become some of those important ions and electrolytes. Versus some of my patients, they're like, no, doc, if I smell soup, I'll throw up again. And that's why they don't get those basic building blocks. And to those folks, I recommend, aside from water, really try putting in some Pedialyte if you're a kiddo, Gatorade if you're an adult. Some folks do like to add electrolyte supplements that are in packets to their water. But if one is concerned about that sugar content, there are companies that do sell electrolyte supplementations that can just be added into the water. When in doubt, chicken soup, very simple. Even as bland it can make it, that typically packs a lot of electrolyte. I mentioned Pedialyte. Even though Pedialyte has the pedia for thinking pediatric, I know a lot of adults who still drink Pedialyte. But typically, things that are for children, people try to make those as safe and as kosher as possible. And so adults drink Pedialyte in part because that is very helpful for children. And really the only difference for Pedialyte versus adult light, I would say, is just the amount of the electrolyte. But Pedialyte is very, very safe to take in adults as well.